Parirenyatwa Group of Hospitals is the largest hospital in Zimbabwe, and it also holds the largest COVID-19 isolation center. Today we have come to ascertain how the group of hospitals has been coping during this COVID-19 era. Hello viewers and listeners, welcome to Health Matters, a program where we discuss every issue concerning our health. My name is Faithful Mazos and I'll be your host. Nakanchikumbira mama kuti mumbotitaurirawo kuti zvii zvashanduka pamaererano nekushanyira varwere pano pachipatara.
Zvashanduka pano kushanyira varwere pano pachipatara ndezvekuti uko zvino hapasi kuwanda vanhu vakanyanya, pari kuuya vanhu vashoma shoma, uye murwere ari kupinda achionekwa nemunhu wani. Saka ndo chinhu chikuru chashanduka pakuona varwere pano pachipatara.
Imi munozvionawo sei?
Ndozvona zviri zvinhu zvakanaka, nokuda kwokuti vanhu mapindiro ataita paipai vanhu vanenge vakawandisa zvokuti zveshuwa nokuda kwechirwere chiriko, unogona kuona kuti vanhu vanogona kungozadzana vakanyanyisa kuti wanda.
Alright, asi varwere mukuona vakachengetedzeka?
Varwere vakachengetedzeka, asi senge panyaya dzemara ndo nyaya dzanyanyisa kumanikidza zvokuti dzimwe mari dzacho unotoshaya kuti unoiwana kupi.
Mari yemibhedha kana yemishonga?
Mari chaiyo kana munhu akanzi aitwa operation, unogona kunzwa kuti operation iri kusvika kuma 70 chakuti 1000 mubhedha kuma 11,000. Saka unoona kuti ipapo zvakarema zvisingaiti.
Kubvira zvatanga COVID-19 munoona sekuti chii chashanduka pakushanyira kwamunoita varwere?
Isusu murwere watachishanyira manje anga asiri weCovid, anga asina COVID.
Anga asina COVID, asi kuti ma-visiting hours makuenda vangani?
Ka1 kamwe chete.
Alright, munoona sei kuenda kungoona murwere kamwe chete?
Zvakanaka, nekuti zvinoita kuti vanhu vasanyanya kuungana.
Asi munoona varwere zvenyu vari kubatwa zvakanaka?
Varwere vari kubatwa zvakanaka zvekuti
muri kugutsikana zvenyu nebasa
rese.
Today we have Mr. Linus Dire, the head of public relations here at Parirenyatwa Group of Hospitals. Mr. Dire, welcome to the program.
Thank you very much.
May you please tell us about Parirenyatwa Group of Hospital? What do you boast about?
Actually, I would say, as you are aware, Parirenyatwa Group of Hospitals is the largest health institution in this country. And we have got quite a number of specialist services that we offer here at the hospital. And of late, we have been designated the largest COVID-19 treatment and care center in the country with 425 beds.
COVID-19 virus has been with us for more than a year now. What can you say has changed to your day-to-day business?
I would say business has not been as usual since the beginning of the pandemic in our country. As I said earlier on, that we started off by establishing the largest COVID-19 treatment and care center in the country. So we actually have almost the half of this complex into a COVID unit. And a lot of things, goes with that. It also means you are now treating both non-COVID patients and COVID patients. And we have had also to introduce some new guidelines and new protocols to ensure that we are able to manage both non-COVID and COVID patients in the hospital. As you can see now, we even introduced the new systems like that. All patients coming into the hospital now, you have to go through screening for COVID-19. As of late now, we are also actually requiring that all patients get tested for COVID before they get into the hospital using the antigen tests, whose results can only be obtained probably after just 15-20 minutes, so that we know how to treat all our patients. So really there's been a lot of changes caused by this new pandemic in the way that we do our business.
Is the antigen test free of charge?
Yes, it is free of charge for all patients, yes.
Okay. Yeah. In terms of visiting hours, how many visiting hours do you have?
Yeah, in the past we used to have 2 visiting hours, 1 to 2 and 5 to 6. But now we are only restricting visitors to between 1 and 2, and only 1 visitor per patient in order to decongest the hospital.
And how did the people see that? How did the patients and people from outside react to that?
It is very difficult, I tell you, I can assure you. It's very difficult to accept from relatives and the patients themselves. You know, I think that's a bit cultural. People would all want to come and see a patient. And if you don't come to see a patient, they will say, where is so and so. So it's not easy. So controlling even the people who come to the hospital is very difficult. They also try to find their ways into the hospital. You are trying to control all entrances, but some will still end up in the wards.
In terms of sterilizing your premises, I'm aware that hospitals do that,
Yes.
and you normally would do that.
Yes.
But now with the COVID, what's the frequency of your sterilization, fumigation, and all?
I would not, yes, there is the routine fumigation, but usually it's also determined by events happening in the hospital. You can say, for example, you do fumigate more regularly in the COVID unit than what you would do in other areas. And sometimes you can also have even more people getting infected, then that means you also have to do it more frequently. So I think it depends on the circumstances that are happening in our different units. But the regular fumigation actually is always done.
We are standing in front of the accident and emergency department, the casualty department.
Yes.
And most cases that come through this entrance that we are looking at are emergency cases.
Yes.
So if someone is about to give birth, do they start off by going for the test, or you admit them first and then they get the test?
Like I said, you are aware. We actually have got also a team at Mbuyana and the maternity hospital, actually stationed at the maternity hospital there. So quickly an antigen test is taken because you also want to know how you are going to handle the patient. Then they are quickly admitted. We don't even have any delays in terms of admissions here. So all emergencies actually, some who come in their emergencies, they actually tested when they go into the resuscitation room already. But tests are done there while they are already receiving their care.
Okay. Due to the COVID ward that you said is occupying the greater part of the facility, don't you have the maybe minimum cases of maybe the COVID virus transmitting to the other patients? Or you make sure that that place doesn't interact with the other ones?
Not at all. There is no possibility of that because we have actually barricaded what we call the red zone. We have put some barriers to ensure that at least there's a movement, movement, or we have actually established some ways of moving, guidelines or movements of patients. So red zone patients will actually use their own route, go into their wards. The green patients use a different route to there. So there is no way that when they are in the hospital they get to mingle. There's no way.
There is no interaction?
There's no interaction at all.
Okay. Someone would want to know if Parerengatwa Hospital is safe.
In terms of?
In terms of hospitalization or treatment?
Yes, we can assure everyone that you are safe when you are here. Because, for example, in terms of COVID, that's why we have separated the green zone from the red zone to ensure that the patients, those patients who do not test positive, we expect that they remain positive, they remain negative until their time of discharge, while they are in their own area. But as it is now, it is very difficult now to say people are absolutely safe, because as long as some visitors are also coming to the hospital, the chances are high that they will also bring in some infections from outside. And remember, we also have got different people working in the COVID unit. In as much as they continue getting tested and so forth, but here and there you can get some cases also of some hospital-acquired infections. But those ones are very rare in this hospital.
Are these visitors also tested?
No, they are not tested. But they are only screened as they get in. They are also taken their history and so forth. Those who require to be tested can then be sent to be tested.
Okay. Do you think that has been very effective in trying to reduce transmissions, COVID transmissions to your patients in the other zones?
I think it is really working. Like I said, in terms of screening and testing of patients, once a patient is actually screened and tested, you know exactly how to treat the patient. Whether you are going, we have got 2 casualties here. We have got this one, who is the main casualty. We also have got a patients waiting investigations unit in our A2 ward, where we have all patients who have tested positive. There are doctors who are stationed there also to then decide on the course of action to be taken.
COVID cases are on the increase in the country. Have you perhaps found a greater number of people coming for admission.
Yes. There's been a real increase in the number of people that require admission for COVID. Yes, I would say so.
And you have enough equipment to assist, like the ventilators and the oxygen?
I wouldn't want to say we have got enough, because you know what happens is that demand also increases. You know, demand for equipment, demand for human resources, demand for everything increases as you also admit more and more patients. So as we admit more and more patients, you know, also more human resources, more equipment will also be required. But at the moment, I would say we are generally coping.
Okay. Your advice to our listeners and viewers who are watching, they could be the next patients to Parirenyatwa or visitors to Parirenyatwa.
I would just want also to advise you know, the people of Zimbabwe that it is very important that these days we observe the guidelines and protocols that are being given by the government in terms of COVID management. You will really be surprised to see people here coming to the hospital not wearing masks, which is very bad. So we encourage people that at least let's all be in our masks, because we all know that we get this virus mainly through our mouth and our noses. So it's very important that we keep on masking, and you also make sure that we wash our hands regularly, because you may catch it, you know, from all surfaces and everywhere where we travel. It's important that we wash our hands. And even when we say let's not gather, let's not be in crowds, I think it's very important that we avoid the crowding these days, because once we've got somebody who is infected, chances are very high that they can also spread it to other people. So really it's all about observing the guidelines that we are given these days.
Can you please tell us how have been the effects of vaccination as far as admissions are concerned?
Thank you very much, Faithful. That is a very important question. Actually, we would safely say as a hospital, we are admitting more than 200 patients in the hospital. And I think viewers should also realize that all those people who actually require admission at our treatment and care center are those who have severe symptoms. Those who are moderate to mild normally are recommended to go home for isolation. So this means that almost all the patients that we have admitted here are serious patients. And more than 90% of those patients are actually unvaccinated. So it is very important that as a nation we realize the importance of vaccination, so that at least we should actually increase in terms of uptake, because this is real evidence that vaccination works.
And how's been the vaccination uptake?
Here at our hospital, I believe we are also vaccinating the huge numbers, because we are vaccinating more than 1,000 people in a day now. So really we can say it is really, you know, quite pleasing that a lot of people are now taking up the vaccination program.
Thank you very much. You have heard it, viewers, that we should all adhere to government regulations. That is to mask up, sanitize, and exercise social distancing, because COVID is real. Until you join us again on the same place and same time, it's goodbye for now.